Thank you for bringing him to the planet because he's now helped me. Love you.
Well, that's sweet.
That's
Thank
really
you.
sweet.
Take us back. Tell us a little bit about the process you went through with your breasts.
I have a family history of breast cancer on my mom's side. My mom was about my age that I am now when she was diagnosed with breast cancer. She had a lumpectomy, she had chemotherapy, and she's fine now.
Oh.
Given that history, I finally broke down and did it, and sure enough, tested positive for the BRCA1 gene mutation.
So you had the double mastectomy.
Mm-hmm. And then once they finally let me go home, and I went back to the plastic surgeon for my 1-week follow-up, and he undid the bandages I had. It was just black. It was very scary looking.
It was also because she had the nipple banking done.
Tell us about the nipple banking.
Well, that came about, it was kind of his suggestion. He said, I can take your nipples and bank them on your lower abdomen, and then come time for the implant exchange, put them back on my chest.
I would say less than 2% of surgeons in this country use nipple banking because it doesn't work very well.
My oldest daughter is 22, and my next oldest daughter is 17.
Okay.
And the fact that I did test positive for the gene mutation, it scares me. But also I feel like at the state that I'm in, I don't feel confident enough to go to them and say, yes, you should get tested because look what happened to me,
It's been an emotional roller coaster for Maria. Hearing that she will not talk to her daughters about being tested until she's fixed, that must weigh heavy on Terry. I mean, really, lives are at stake here.
Make you a deal. If we get you to the point where you feel comfortable with your breasts, we immediately go back and have them tested for the BRCA gene?
Absolutely. Absolutely.
Okay, let's go have a look.
Okay.
Maria's case is particularly at high risk for a complication for any subsequent surgeries we may do on her. I will know more once we get into the exam room and see exactly where the scars are and the quality of the soft tissue and skin and get a better idea about the blood supply. So it must have been quite a shock when Addie was born, your beautiful baby, and they suddenly scooped her away, right?
She was pretty.
Right?
She's still pretty.
Oh, yeah, gorgeous. But they scooped her away, and what happened?
They told me it was like a Siamese twin.
Right.
But I never got to see it. They always kept it wrapped. They wouldn't let me see it.
Huh.
Well, they won't let you see what?
Whatever was attached to my daughter.
So they operated on her?
Yes, at Children's Hospital.
They probably knew that the twin wasn't viable, and in your condition, having just delivered, didn't want to upset you. And so just wanted to kind of probably cover it and take care of it. Do you have any connection or thoughts about having had a twin?
Well, as a child, I used to sit in a room and have a conversation with myself. As a kid, knowing that I had a twin, but I never got to meet her, I felt a little incomplete. But as I grew older, I was able to come to terms with it.
So she had the surgery, and then you got her back, and you knew she had now a deformity, sort of, right? What was it like as she was growing up with this situation back there for you guys?
Like, she didn't really complain until she got a teenager.
And teenagers are bullies.
Yes.
Did you get bullied?
When I dressed out for PE, the girls knew it. They noticed it.
And what happened?
They started teasing me and calling me, hurtful names. The reason why I'm so shy is because the bullying caused me to isolate myself from everyone. I didn't want to get hurt no more.
Let me ask you a question. When you look in the mirror and you say, this one or two things bothers me the most that you wish you could just make go away.
My eye.
What about your eye?
I don't have two of the same eye.
You have a little unevenness between the eyes?
Yeah. And then they did do a nose surgery. Just the scar tissue on the right side is just really a lot of scar tissue in there. Like if I had to rely on it to breathe, I'd suffocate. And
so you have right nasal airway obstruction.
Yeah.
Could you just tell me a little bit about this emotional journey? Because your mom, who you love more than anything in the world, has a major injury, could have died. She comes home, and what was that like?
I really just don't remember.
You don't remember what?
The details of, like, what I did on a daily basis.
Did you know that? Is this the first time you're hearing that she's blocking out this whole traumatic incident? How do you feel about that?
Not good.
It's been hard, but it's more important to me that my mom
doesn't see herself as a monster anymore. My mom is my hero.
Before my surgery, my face was destroyed by a motorcycle accident. I had a disfigured left eye and mouth. I also couldn't breathe due to my right nostril being closed off from all the scar tissue. I hated what I saw in the mirror, and I hated what it did to me and my family. But now, thanks to Dr. Nassif, I can breathe. My eyes are more symmetrical, and I can finally look in the mirror and not hate what's looking back at me. I'm excited about life for the first time in a very long time.
I had really bad allergies.
Nasal drip or what?
I had bad nasal drip, and they prescribed a bunch of different nasal sprays. I was using it like 5 times a day, at least 5 years.
Ooh.
We suggested surgery.
So did the doctor say they were going to do septoplasty?
Septoplasty.
Tribunoplasty?
I heard that one too. Yes.
So that's
Reasonable.
a functional surgery that doesn't change, usually, the outside appearance of the nose.
And I had no problem with the cosmetic side of it.
So what happened?
After 2 weeks, when all of the packing started coming out, he had me sit in a shower. I would blow it out gently. He suggested a revision. That's when I started to notice a lot of this was really not how it used to be. Yes.
So only after the second surgery,
Yes. So
your
there
nose
was a
started
difference.
looking different.
Yeah.
Just going on a date and eating in front of somebody, having to like breathe through my mouth.
When food is falling out of my mouth on a first date, that does not go over well.
And so I've lost my love life as well.
Today for Jessica's surgery, Dr. Peng will harvest rib while I begin by opening up the nose. Next, we'll assess the septum before rebuilding the nose with spreader grafts so she can breathe better, and a septal extension graft for support. Finally, we will use a diced cartilage glue graft to build up the dorsum and correct her saddle nose deformity.
That looks great. Beautiful result. Thank you, thank you, thank you.
Now, I'm finally able to breathe, and I'm in love with my nose. I catch myself staring in the mirror quite often. Now it's more like, let's go outside, let's do something. I just am enjoying life a lot more than I was. Before my surgery, my nose looked like a Rocky Mountain range, and I just simply couldn't breathe. After 3 failed surgeries, I had lost all my trust in doctors. But now, thanks to Dr. Nassif, my bridge is straight, and my breathing ability has easily gone up 60%. You know, I feel like I could run a marathon. Dr. Nassif and Dr. Dubrow definitely changed my life. I'm actually seeing someone. I feel like Dr. Nassif definitely helped me get a boyfriend.
Can you tell your mom I sent a big hug and kiss and thank her for bringing you to the planet? Can you please do that?
You know what? I'm going to send a video message to my mom from Raji, because she knows who you are. Everyone knows you. And she knows how much time I spent thinking about, all right, you want to say something to my mom? Ready? Go.
Hi, Mom. I just want to thank you so much for doing such a wonderful job on your son. Dr. Dubrow is the greatest. Thank you for having him. 9 months of carrying him around and delivering him. Thank you for bringing him to the planet, because he's now helped me. Love you.
Well, that's sweet.
That's
Thank
really
you.
sweet. You're so cute.
Raji's message to my mom is really sweet. This just solidifies why I got into plastic surgery, to help people just like Raji.